Should we get started? Okay, all right. Let me know if I'm not speaking loudly enough. I know I have the microphone on for the camera, but please let me know if you can't hear me. So my name is Ivona Percec. I'm a plastic surgery attending at University of Pennsylvania. I want to start out with telling you a little bit about my personal information. I grew up in Romania. At the age of 9, we moved to Ohio, and then thereafter I spent my time between school in Ohio and spending all of my free time in Paris. I then attended Princeton University, where I did 2 majors, one in molecular biology and one in medieval history of medicine. Spent a year at Harvard doing some research, and then I did the rest of my training at the University of Pennsylvania, where I did my MD and my PhD in genetics. I also stayed there for my residency in plastic surgery and then subsequently joined the faculty. My interests are really the prevention and treatment of aging. My goal is to really understand the genetic causes of aging and all of the other causes of aging. And clinically, I focus on face and body rejuvenation, surgically and non-surgically. So who are we at Penn Plastic Surgery? Well, we have 12 plastic surgeons right now who focus on aesthetic and reconstructive surgery. We have very specialized plastic surgery nurses, assistants, and administrative staff. And of course, we're part of a very large multidisciplinary academic center, which allows us to have a lot of resources that perhaps somebody in private practice may not have. So we work collaboratively quite a lot. In terms of our skincare program, what you may not know is that we actually have a skincare program as part of the division of plastic surgery. We work very closely together. Right now we have 2 medical estheticians. You'll see Jean in the back, Jean wave, and Amy. And they've fortunately been able to join us tonight. And they're amazing, and I work very, very closely with them. And we're continuing to build that part of our program, and we're in the process of hiring an additional person just because we're so busy. We also have a skincare coordinator who specialized in just dealing with skincare, that's Connie. And then skincare staff who, including my assistant Wadia Timothy, Rose O'Neill and Linda DeAndrea, sorry you can't see at the bottom, and they all work together in plastic surgery, but they know all about the skincare, so they can very effectively answer a lot of questions. So where do we see patients? Well, we see patients downtown at 34th and Civic Center, as you know, PCAM or Perelman Center, whatever you want to call it, Center for Advanced Medicine. And then we also see patients here out at Radnor, and hopefully with time we may expand to other sites as well. And feel free to ask any questions, and feel free to interrupt me. I'd like this to be as casual as possible. So the goals for the session tonight, as well as many of the goals of my practice, are really to connect with people, to educate them, to teach them about what we do, what works, what doesn't work, and recognizing that most of the people that I see are women, but I also see a lot of men, more and more actually. And women in particular are so busy caring for others that they often neglect their own healthcare needs, and not just from aesthetic purposes, but overall. And in addition, women often feel guilty about wanting to improve their appearance, and they're willing to take care of their families and their children and their houses, but they don't often feel okay or comfortable about taking care of their appearance. And recognizing and knowing what we know now is we need to establish good skincare and body care habits early in life. And this means educating really our young patients, patients who come in their teens and early 20s. A lot of the men and women on the campuses of Penn, I'm starting to give a lot of talks to those women. Also the students at Villanova, just because they need to learn about sun protection. They need to learn about how to take care of their skin. And in many places in the world, like in Europe, those habits are really taught early, and we've failed to do that, unfortunately. So what is the problem that we deal with, or that I deal with mostly, and that is aging. And as you can see, a woman on the left, an ideal face, which doesn't really exist. And what happens with it to that face with time? Well, there are a lot of different changes. You can see that the furrows have formed in the forehead, in the lower lid, in the nasolabial folds, that the skin doesn't quite look as bright as it should. that there's laxity, that there's gravity, there's descent. There's also some deflation, that nice youthful volume, those cheeks that babies have, that's been lost. The other problem that we face is not just the aging, but all of the hype. I mean, plastic surgery is focused, or featured rather, more and more in the media. And while that is a good thing in some ways, it's also very hurtful, because I think there's a lot of misinformation out there, and people really try to sell a lot of products that don't necessarily work and can hurt. And so our job, especially being at a large academic institution, is to teach patients and to teach the public about what works and what doesn't work. And a lot of these things we're still trying to figure out. But for better or worse, the demand continues. I mean, people want to look as good as they feel. And so you may be in your 40s, 50s, 60s, and you're taking care of your body and you're taking care of your health, and you just feel like the outside of you doesn't match the inside of you. And I would say that's probably the most common thing I hear. And so this is actually from an article that just came out recently, is Over 50 the New Sexy? And it featured these two women who are in their late 50s and early 60s. And it really discussed why people now want to continue their prime into their 60s and 70s and beyond. And that is going to continue, because as our life expectancy increases and as we take better care of ourselves, that's just to be expected. So what kind of tools do we have overall to address all of these issues? Well, if you consider the tools of rejuvenation or anti-aging as a pyramid, you can see that at the bottom are the most common things, like lifestyle aids, magazines, books, self-help type items, things that you can do yourself, such as exercise, supplements, and then taking care of how you dress yourself. Then the next level up, that's a little bit more less inclusive, are topical treatments. Topical just means apply to the skin. And that means skin care, any of the laser treatments, any of the laser-like treatments like IPL, and then a little bit more invasively, injectables that I'll talk about later. And these you can sometimes have at a med-spa or a dermatologist's office, or sometimes in our office. And then the top of the pyramid, which is the most invasive and probably the most exclusive, is surgery. And we as plastic surgeons can really do and have embraced all of these things in many ways. So in order to really provide a solution to an aging face or an aging body, you have to really first understand how those things age. And really, to understand that, you have to realize that it happens from the inside out. And it not only affects just your skin, but it affects your bony structure, which changes with age. It affects your soft tissues, the fat that goes away with age. And then it affects the skin, and that's the most easily appreciated change. So just to give you an example, I bring back this unrealistic picture of this aging face. What you can see is that you lose bone volume, so your cheeks actually lose volume. Your maxilla, which is the upper part of your jaw, it actually decreases in size with time. So it gives you that concave, sort of sunken in appearance. That's not necessarily appreciable to the person when you look at somebody, but if you look at a CAT scan, you can see those changes with time, and those studies have been done. We also know that unlike the intra-abdominal fat, the fat that's inside your belly that actually increases with age, that the fat that's in the subcutaneous plane or under the skin decreases. You lose volume in your bony tissues, you lose fat volume, and by fat, I mean the fat that's underneath the skin. You just lose this overall volume. And in addition to that, the connective tissues, which are the tissues that really connect the soft part of your face to the underlying bony skeleton, those become loose. And so you actually end up looking more lax, or what we call ptotic, which just means loose tissues. And that's because the tissues on the outside are not connected to the inside as tightly as they used to be. That's something that we've recently begun to understand. Everybody knows about gravity descent, and then most people know about what happens to the skin, that you have decreased collagen, you have decreased elastin, so your skin's not as elastic. The wrinkles that form due to motion are very evident. You get hyperpigmentation typically, where are those little sunspots all over your face or your chest. And then overall, you have just decreased cell turnover. So your skin's not turning over as quickly, it doesn't look as bright, it doesn't look as fresh. So all of these things we recognize we're learning more and more about on a regular basis. So for each patient that we see, whether I'm seeing the patient or Jean's seeing the patient or Amy, we really talk about where is each patient in the aging process. Are they early on? And so what we want to do is talk about skincare and prevention of aging, or are they a little bit further along, maybe in their 30s or 40s, and they need skincare as well as maybe an injectable, or are they even further along? And our goal really is to prevent, treat, and then maintain what you've treated. And I want to talk about all of these 4 options, starting with skincare, just because that's the least invasive and that's where people should really start. So what can we actually treat effectively with skincare? And is this true? And it is true. We can treat fine lines and wrinkles, not deep wrinkles, but fine lines and wrinkles. You can treat acne with skincare. You can treat melasma with skincare, which people don't know. Do all of you know what melasma is? This spotting that can happen often post-pregnancy or with use with oral contraceptives, or sometimes just naturally with sun exposure. Typically occurs on the cheeks, but people think you can't treat it. Well, you can. Rosacea, which is that redness around the nose and cheek areas. You can treat that. Just dull skin, combination skin, sunspots, and then we can also effectively treat facial and body hair. And the kinds of tools that we use are the following. We do chemical peels. Jean and Amy do very nice, beautiful chemical peels. If somebody needs something a little bit deeper, then I'll do it at a higher level of acid. And that's how we work together. If they've tried, let's say, a 15 or 10% TCA peel, which is one of the acids that we use frequently, and they haven't gotten the results, they'll come to me and they'll say, this person probably needs something a little bit deeper, but they're not comfortable with going to that level. And so that's where I step in. And like you asked about dermatological things, those types of deeper peels can be done by dermatologists, not that they're covered by insurance typically. Microdermabrasion, do all of you know what that is? It's basically almost like a sanding down of the upper surface of the layers of your skin. That's very effective, especially when combined with a peel, because first you take off that layer with microdermabrasion, then you apply the peel, and it's actually much more effective than if you were just to apply the peel directly without taking that layer of dead skin off. We also do dermaplaning, which is a more mechanical way of getting rid of that top layer using a blade. And typically these top 3 are done in conjunction with one another when you come to our office for a facial. Well, we don't even call it a facial because that invokes, you know, the whole massage and the music, and we don't do that. We're very clinical. We want you to have an effective treatment, and we talk to you about what's effective. And so you're not going to get the massage of the scalp or your feet rubbed. It's very, very clinical what we do. IPL, intense pulse light. It's not a laser, it's similar to a laser, but it's very effective for sunspots, especially on the hands, the chest, and the face. You can also use it for those little red veins that sometimes you get around your nose or around your face, as long as they're small enough. Laser hair removal we do quite frequently. It's very popular. It requires multiple treatments, but it works very, very well, and it's something that's become more and more popular over time. And unlike places that I don't even know what those centers are called, but where they do lasers and that's all they do, we are very meticulous about studying your skin type, and not if you have, let's say, a higher or a darker skin type. We're very meticulous about avoiding burning and really targeting our settings to your skin type, because a lot of places don't necessarily do that. They'll just put it on one setting and treat everybody the same. And you can actually get burned with these types of lasers. Micropigmentation is something that you probably know as cosmetic tattooing brows, eyelids, lips, etc. We also do it obviously very frequently for our breast cancer patients for their nipple areola reconstruction, and for some of other patients. So we offer it both in a cosmetic sense as well as a reconstructive sense. I always include this because I always get questions on it. Lash lengthening, Latisse. It's the only FDA-approved product for lengthening, thickening, and darkening your lashes. It's very popular. Patients, once they try it, they love it. You do have to purchase that through an MD's office and have a consultation first. Okay, so from a skincare standpoint, what do we do? Well, most patients will either come to Jean or Amy, or though sometimes they'll see me for an aging consultation. I'll say, you don't need injectables, you don't need surgery, go take care of your skin. And so I will send them to Amy or Jean, and they work the same days that I do. So they will have a consultation with them. They'll come up with a treatment plan that's personalized for them, not only their budget, but also what they can tolerate. Some people want to have 2 products that they'll use meticulously, but they can't deal with more than that. Other people want to have a whole cabinet of products and love playing around. And we just tailor our treatment plans to the patient, and we can do that because we have a lot of products at our fingertips. We not only work with a lot of companies, but have a lot of products from each company, so we can tailor that in a way that other places can't. We're very good about our follow-up. We expect to see you. We expect to know what's going on with your skin. We will call you. In addition, we have the most new and cutting-edge products that we trust. We try everything that we have. We speak directly to the companies. I work with them directly. Jean works with them directly. We also have seasonal bonuses, specials for our patients, for our students, for our employees. We have things that are specific for our breast cancer patients. I mean, we really try to do as much as we can for our patients, because our goal is not necessarily to make a profit, but to really treat patients well and really teach them about how to take care of themselves. And then we also have clinical trials of new regimens. Either it's a new peel or a new machine or a new laser. So we're always on the cutting edge of that. And being at Penn really does help. I want to bring up a couple of the products, because what we've recently done is incorporate some of the skincare into our perioperative regimens. By that I mean, if somebody who comes in and is going to have a facelift, and is going to invest the time and the finances to go through that process, but they don't know how to take care of their skin, either before or after, and they're given no information other than their standard post-operative regimens, well, their result is going to be suboptimal. One, they won't be prepared before the procedure, and post-procedure, they won't know how to take care of their skin, and they won't be able to maintain their result, so as well as they normally could have. So we've developed skincare recommendations specifically for our surgical patients for before and after. And there are a couple different lines that we use. The Aven line, which is based on a thermal spring water line, and is very, very safe. It was actually developed for kids with dermatitis, with psoriasis and eczema. It's very, very gentle. We use that before, post-laser, post-facelift, post-surgically. It's very, very good. The line down here on the bottom left is one that we use in a lot of our cancer reconstruction patients, because it's been shown to be safe in those patients undergoing radiation or chemotherapy. The line on the bottom right, and I apologize, I don't have a pointer, is one that we use very effectively. It's based on glycolic acid. It's actually the same parent company as Aven, but it's the much more aggressive and effective line. And we know these companies and these products work because a lot of times we actually visit the sites. This is actually the Aven Hydrotherapy Center in the south of France. And it was developed for kids, and you can see in the bottom left all the drawings that the kids made. And this is actually covered by insurance in Europe. And so these kids are sent to these hydrotherapy centers where the spring water bathes them, and they use these cold creams and moisturizing creams afterwards. And they actually have resolution of these problems. And it's covered by insurance because they know it works. I mean, we don't have anything like that in this country, but that doesn't mean that it doesn't work. And sometimes we have a few barriers with the FDA that we can't quite really succeed against. The picture on the right is one of the botanical centers where they try out different plants. And so they try the effectiveness of different plant regimens. Some of the products you may have heard, and I bring these up because I always get questions. Latisse, like I said, Juvederm, which is one of several fillers that we use, Botox, which is one of the neurotoxins that we use, and then Nitrel, which you may have heard of because that's one of the more common breast implants that we use. And I'll talk more about the specific injectables. This I wanted to show you because it's a patient of mine who came in for a Botox injection. You can see the sites that I injected on her forehead with those little red dots. And as I was looking down at her after I'd injected her and I was cleaning off her forehead, I said, "Oh my God, look at your lashes." And this was really before I believed in Latisse. And she said, "What are you talking about? I got this from you. It's Latisse, and I've been using it for 4 months, and it's unbelievable." So, you know, my patients are the ones who teach me quite a lot. And it really does work. And it was after seeing her that I started using it. Another just example of how you can have a really nice result just using skincare. And this is Glioma Peels. They're not that strong. They're very easily tolerated. And this was after 5 treatments with a really nice improvement. And this, as you can see, is a young girl with acne. Another one, really sun damage of the neck, and then superficial chemical peels. And we have peels that are specific to the eye area, to the perioral or around the lips. We have hand peels, we have neck peels, we have chest peels, really different peels that are different combinations of acids that have been shown to work specifically for those anatomical areas. Here's another patient, 3 patients with Latisse. So the way this works is that, as you probably know, you have to use it every day for 4 months. And that's your induction period. Thereafter, you can go on maintenance. Some people have to stop early because their lashes grow too much and it hits their glasses. But then you switch to every other day or every 3rd day, and they actually get darker and thicker. And there are a lot of conditioning agents that are sold by non-medical companies. This is actually sold by Allergan, which is a very well-respected company. At not inexpensive prices, and those agents just do not work. They may look like they work, and they may look like a mascara, but they don't actually make your lashes grow or make them thicker. And the reason this is important is that as you age, we know that the aperture of your eye or the opening of your eye gets smaller. So what people tend to do to compensate, and I know this because I used to do it myself, is really add on more makeup or put more eyeliner. And that just makes you look older. Instead, if you were to do something like this, you would have a brighter, fuller looking eye or more open looking eye, and you would end up using less makeup because of the fact that it just opens your eyes. So I always get asked this question, so I included this. What's our recommended basic skincare plan? You need some kind of a facial cleanser, depending on what your skin type is, whether it's dry or not dry, whether you need something to stimulate turnover. You need some kind of a scrub that you use in the shower, because most of the products that we're going to recommend are going to result in increased cell turnover, and so you're going to need to get rid of that dead layer of cells that's going to start peeling off. The best agent, if you're going to pick one, to combat aging is retinoic acid by far, or retinol, which is a relative of retinoic acid, and it's much more mild, and it's really for people who can't tolerate retinoic acid. And the retinoic acid comes in many flavors, many companies make it. There's one that I prefer because I think it's the most effective and also the best tolerated. It's called Avage. It's something that we carry. It's prescription strength only. You can only use it at night. It makes you sun sensitive. It'll make you red. It'll make you peel at the beginning. But once you get into it, it does wonders. Not only because it stimulates your collagen, but it also smooths out the fine lines and wrinkles by doing that. And it also brightens your skin. So a lot of those sunspots that are there. And this is something I like to start my patients on early in their 30s. If I can convince them, because of anything that you start, this is the most effective. And you know, the person who invented it was a Penn dermatologist, so we've had a lot of history at Penn with it. Vitamin C and E serum is something that's very effective when you combine it with retinoic acid, and we have very many different flavors of vitamin C and E. And that's because they work really well to brighten and tighten your skin. So if you put these serums on in the morning after you've scrubbed your face will feel so tight and glowing that it really, really works. Alpha hydroxy acids are the third really weapon in your armamentarium. So either a glycolic, a lactic, a salicylic, depends on what your skin tone is like. And those three agents are really the most important. If you were to tell me I can only get three things, buy over-the-counter cleanser, buy over-the-counter exfoliating scrub, whatever you want, as long as it's not really perfumed or full of chemicals. St. Ives is one I often recommend to patients if they don't want to be spending all of their funds on all those creams. But focus on your retinoic acid, focus on your vitamin C's and one or a couple of the glycolics. Sunscreen, very, very important, often misunderstood. A lot of people think, oh, I'll just get an SPF 80 sprayed on my face and I'm safe for the day. Not true. That protects you against a little bit of UVB. It wears off within a couple of hours and you're unprotected. Also, a lot of the sunscreens that are those spray types, they're full of things that really are not so healthy for the skin. What you need is a sunscreen that's of decent SPF. 30, 40 is fine. Even 25 is fine. What's more important is, one, that you have a mineral oxide added to it, which protects you against UVA. So that's either copper oxide, titanium oxide, zinc oxide, one of those agents. And now they're micronized, so they don't feel like you're putting on toothpaste on your face. They're much more cosmetically elegant. You can put them on top of your moisturizer. And that in combination with an SPF that's mid-range, as long as you reapply it, is much safer for your skin. And women in particular are the least likely to apply sunscreen on their faces. Why? Because they like to wear makeup, and you're not going to glob on sunscreen and ruin your makeup in the middle of the day or mid-morning. And so what we carry are foundations that contain all of these agents. We have powders, both untinted as well as tinted, so you can just put it on your face and it gives you coverage, and you just carry it in your purse. It's very easy. I do it. And so they make it easy for you to protect your skin. And then we carry all the body lotions. The regular peels and microdermabrasion I spoke a little bit about. The reason I bring them up is because you can do some mini peels at home, and we have those as well that come in packs that you can do. But to have a regular office peel, something that's deeper, it's going to allow your products to be more effective. And it's just going to allow your turnover to be higher over the course of the year. Ideally, you do this monthly. If you can come only 4 times a year, that's okay. It's better than not coming at all. And we just modify your peel to that regimen. So if you only can come in every 4 months, then we'll do something deeper for you. If you can come in monthly and you're more sensitive, we'll do a lighter one every month. And then we talked already about Latisse. The next area are injectables. So once you've done your skincare, once you've taken care of your skin and you find some signs of aging that are not quite correctable, then we move on to the next line, which is injectables. So what can we do with injectables? Basically, an injectable is anything you inject into the skin, whether it's a filler or a neuromodulator, such as Botox. You can prevent and treat motion-related wrinkles, and I'll show you pictures, like the furrow lines, the brow lines, the crow's feet. With fillers, you can correct the superficial and slightly deeper wrinkles. You can actually add volume to the cheeks, add volume down here, add volume to the lower lids. And in patients who are not ready or may never be ready for surgery, you can delay surgery or avoid it. So where do we inject injectables? I have here in red Botox, sites where we can inject Botox, and you can see the forehead, the glabella area, the crow's feet here. We inject it actually into the chin. As you age, you get what we call mentalis strain. You get this puckering of your chin that just doesn't look relaxed or natural. We also actually inject it around the mouth as you develop those fine little lines. That's one agent you can use. The blue are the injectables that are fillers. So when you get these furrows, if you don't come and get them treated with Botox early on, they develop into a deeper ridge. Well, even if you Botox it, that ridge stays. So sometimes you use Botox to paralyze the muscle, and you use a filler to actually fill the divot that doesn't go away. You can fill the lower lids. That's a very effective way of getting rid of some of those shadows that you see with time. You can fill the alar bases, which get deeper with time. Botox, we talked a little bit about this already. So 3 to 7 days for its initial effect, up to 2 weeks. Most common indication and FDA approved for these furrows, what we call 11 lines, or if you're unfortunate you have 111 or 1,011. Also the forehead wrinkles and the crow's feet, and like I said, around the mouth and the chin. So here's just a result before and day 14, before and day 14. And as we discussed, you can tailor each treatment. If you come to me and you say, I don't want to be fully blocked, then I will use 40% or 50% or 60%, depending on how, what your tolerance is. There's no need to have a universal treatment for people, and in fact, you shouldn't. Again, I included the one on the bottom because his furrows are so deep that even though his muscles may be blocked, he still has that divot there. And that's a case where if that bothers him, you would recommend a filler. And fillers, these are the areas that we talked about. So the cheeks, the lower lids, the nasolabial folds, we use them in the lips. This area that's right here is called the prejowl sulcus. As you start to form jowls, you get this division between the jowl and the chin. Well, as early on, you can camouflage that by putting a little bit of product just next to the fold. You've heard a lot about these names. Juvederm and Restylane are probably the ones you've most commonly heard about. Those are both hyaluronic acids. They're very easy to use. They're very well tolerated, very low rate of complications with them in terms of allergenic complications. And again, these are the areas that we talked about. There's another agent you may have heard about called Radiesse, which is a calcium-based agent. This is really used more for the deeper areas, for the volumizing of the cheeks, the chin. Let's say you have a small chin, but you don't want to have a genioplasty or a chin augmentation. Well, you can inject this in the chin, and it gives a really nice result for volumizing. Again, down here or the base of the nose, but you want to inject it deep. Don't inject it into the lips. Don't inject it into the eyes. That's going to be a problem. Another agent you may have heard about is Sculptra, totally different thing, polylactic acid. It's used in a totally different way, really for people who have global volume loss, who look kind of, almost like emaciated, because you don't inject it into a specific spot. You sort of inject it into the whole face. It was actually developed for HIV patients who get that really gaunt appearance. For that same reason, you can use it really well in the hands that tend to look gaunt with time, or in the temples. But again, it has very specific indications. So you want to go to somebody who knows what the indications for each agent are. This is just a picture of treatment of the nasolabial folds before and after Juvederm. And again, you don't want to efface these areas. You don't want to erase them. That doesn't look natural. Babies have nasolabial folds. Kids have nasolabial folds. But what you want to do is make them softer, a little bit rejuvenated. And if somebody comes to you and says, I want all of this gone, well, you may not be able to help that patient. The hands are one of the sites, in fact, I did a patient this week, that people are coming more and more to our office to talk about because they've done their faces, they know what that looks like. And it was actually the husband of a patient of mine who I did a facelift on who said, can't you do anything about her hands? And she hadn't even noticed them. But then as she started staring at them, but he said it in a much nicer way. So she came in and we injected Radiesse into her hands, and it works beautifully. It's not painful, and it's easy to do, and it works really well. Laser resurfacing. So probably everybody's heard something about lasering this or lasering that, and there's a lot of hype out there. There's only 2 lasers that we really use, actually 3, but they're both CO2 lasers. One is a CO2 laser, one is a V-beam that we use just for little fine veins and basically blood clots on your face. I'm not going to talk about that. But the one that we use most commonly is the CO2 laser, and most recently the fractionated CO2 laser. You may have heard about things like Fraxel, and those are all just trade names. It's just a way of fractioning the laser beam so that it's not as severely damaging to the skin. So it has a more mild effect, mild side effects, but it also has a more mild effect in terms of improving your laxity and your pigmentation. So we use it really in patients who want a little bit of skin tightening, who are not candidates for facelifts, who have very fine wrinkles and have very fine spots either on their face or their necks or their chests. It's not a panacea, and as we've learned, I mean, this has only been out for a year or so, this one in particular, that these treatments really need to be repeated. And so initially when these lasers were introduced, everybody thought they were, you know, this pot of gold, and what we've learned is that they're not as good as we thought they were. And so you need probably 2 to 3 treatments, and then you'll continue to age. And so as those things reoccur, you may need repeat treatments, but they should last you a couple of years. They're also good for scars, so hypertrophic scars, or thick scars, or white scars, or divoted scars, because they have been shown molecularly and to boost the collagen in those areas that have been treated. And so in the right patient, they can be effective, but it's not a cure-all and it's not a replacement for surgery. It's good for a patient either earlier on who hasn't quite gotten there yet, or somebody who may have already had a facelift wants a little boost in the tightening of the skin just to maintain that result. This is an example of a woman who had some fine lines and wrinkles and pigment around her mouth. And so we treated her mouth, and I put the picture in B just so you can see what it looks like immediately after. You do have a little bit of bleeding, punctate bleeding, that goes away. And then you're red for a week or so, depending on what strength I use. And I discuss the strength with each patient. Certain people want to have a higher strength and really will want to tolerate a longer recovery, but for a better result. And that's a trade-off that is personal, that we discuss. Other people want a much shorter recovery time, but are willing to come back more frequently and get more frequent treatments. And you can modify that to each patient. And there she is afterwards, a month out, no makeup, and just a nice glowing skin that's much more even in tone. But as you can see from the picture on the very left, she didn't have that much to begin with. So it's an improvement, but it's a mild improvement. Okay, surgery. I'm just going to give you a list of some of the things that we do. Brow lifts, eyelids, necks, facelifts, rhinoplasty, which are a rejuvenation of the nose. In terms of the body, breast augmentation, breast lifts, tummy tucks or abdominoplasties. The mommy makeovers are things that I do very frequently because a lot of my patients are young moms who want a tummy tuck in conjunction with a breast lift or a breast augmentation after they're done having kids. Liposuction is very common. Arm lift and thigh lift, not so much, just because we don't have a large bariatric population. Teens. So just a couple quick slides. Through the ages, I put this together because I really like to educate people from early on to later on. So like I said, I do a lot of these talks focus on acne, laser hair removal, sun protection, establish healthy habits in my daughter, in anybody's kids. What a lot of patients ask me about is for their daughters or their sons about doing procedures before college or after college. For example, if you're considering getting a rhinoplasty or a breast augmentation, do you want to do it before or after? Well, what's been shown, at least psychologically from studies, is that it's best to do it before if you're going to do it, because that way you've not entered a new social group and altered your appearance while you're in that new group. It's better just to do it, let's say, the summer before you graduate. or after you graduate from high school, or after college, or whenever it is, just because you're much more sensitive to have something that alters your appearance during that time. In your 20s, you should incorporate some of these vitamins and alpha hydroxy acids. Not really quite time yet for the retinoic acids. The 30s are really the key time to start paying attention to skin. Retinoic acid, peels, certain patients may even be candidates for Botox or fillers. Depends on their face. Everybody's different. And if you're in your late 30s and you were done having kids, that's a time that we tend to see these mommy makeover types. In the 40s, again, intensify your skincare regimen. Consider laser perhaps at this time. This is the time that the eyes really become a focus of aging. A lot of times it's the eyes that people really complain about first, either the eyes or the neck. Eyes more commonly. Again, mommy makeover time if you've had kids later on, as most of us have. 50s, this is a time that is more commonly a time for surgery. Eyes, face, etc. And then 60s, really you can consider surgery, or if you've already had surgery, what you want to do is maintain those results, either with fillers or with lasers or just with good skincare, whatever you can tolerate. But doing something to maintain that result will help make your facelift or your surgery last longer. Well, thank you all for coming out on this rainy evening.